Hi friends, here is a dental implant that is to be fixed inside the bone where our normal tooth root was present. It's a crown that will be attached to the implant and will be visible in the mouth where natural teeth crowns are seen. And this is the middle portion called abutment that will be connecting the crown to the implant. That is the basics of dental implantology. In early 80s and before, to consider an implant successful, that must be stable inside the bone. There should not be any kind of pain, discomfort or mobility associated with that. Such implants we used to call functionally successful dental implants. By 90s, the success criteria has changed. White aesthetics came into the scene. The crown coming above the implant, that should be more natural looking, that should be matching to the neighboring teeth or crowns in size, shape as well as the color. We used to call it prosthetically driven dental implantology. That means the prosthetics, the crown will decide the position of the dental implant. So if there is no bone, we have to build the bone in order to place implant in ideal position to get an ideal crown above that. By 2000, success criteria has further modified. This time, pink aesthetics has also came into the considerations. That means the gum coming around that crown should be matching to the neighboring area in color, texture as well as translucency. So as the time passes, as the patient's expectations increase, the success criteria is continuously getting modified, as well as the responsibility of the implantologist is also going high. So to sum up, if you ask me what is a successful implant in today's world, I would say that implant should be biologically stable inside the mouth, that should be aesthetically pleasing, and it is the aim and dream of every implantologist in this world to deliver most successful dental implants to their patients. But at the same time, it is the responsibility of patient or the person to maintain that success throughout their life by proper oral hygiene habits and regular follow-up and maintenance visits. I am Dr. Shoukath Ali, dental implantologist from Dubai. Thank you for watching. Have a nice day.